As long as you're hearing me okay.
Yes.
Yep.
Forward. Item number 1, presentation regarding fiscal year 27 medical budget projections. We do have Joe Spurgeon with us this evening to discuss the aspect of our this part of our budget for fiscal year 26-27. I'm sure he's going to have a PowerPoint presentation which is going to be presented. Before Joe, first of all, Joe, thank you for coming this evening to present to us. I just wanted to mention that after the presentation, I would entertain questions and comments from elected officials only. Since the public forum is after the presentation, any public comments may be directed to the Board of Finance at that time. But we're not going to be doing any kind of Q&A session with the public regarding this, just a conversation and discussion with a presentation of the elected officials in the room. So assuming that you heard all that, I will hand the floor over to Joe.
Great, thank you for having that up.
That's fine.
Just leave it this one.
Okay, all right, thank you. Thank you for having me. My name is Joe Spurgeon. I work for Lindbergh and Ripple. I've had the pleasure of presenting in front of at least the joint boards before. So probably most of you have heard from me at some point in the many years I've been working with Guilford. So I was asked today to come and kind of walk through our claim history and talk about our initial projections for 26-27. I know that you've already gotten some of the bad news about claims, and we'll talk about what's going on. Let me just first say, I'm sure if you talk to other colleagues in other towns, this is not a Guilford-only problem. It's a national problem right now, but we'll kind of walk through what's going on and why claims are doing what they're doing. You might recall, before I kind of get into the presentation, just to kind of refresh everybody's memory, here in Guilford, we are what's called a self-funded group. What that means is we're fully liable for all claims that are incurred by the members of Guilford. We do use Anthem Blue Cross and Blue Shield as our third-party administrator, but Anthem does not hold any claim liability. So what Anthem does for Guilford is they manage the network, so we have access to all the Anthem doctors, all the Anthem hospitals. We also use Anthem for our pharmacy benefit manager, so we work our pharmacy plan through them as well. They adjudicate claims as they come in, right? Is this a covered claim? Is it not a covered claim? Is this an in-network provider or an out-of-network provider? We do pay Anthem an admin fee to do that. Actually, the vast majority of that admin fee is absorbed by the drug rebates that we get. So the actual admin fee that Anthem makes on the plan is not as big as people think. The vast majority of the costs for our plan are claim related. And that's what's driving the big increase. We do have stop-loss insurance. We'll talk more about that in particular. But what stop-loss insurance does is that protects Guilford from any catastrophic claims. We have $175,000 stop loss, and what that means is if any one individual, whether that's an employee or a dependent, has claims in excess of $175,000, Guilford's only liable to $175,000. After $175,000, the stop loss vendor picks that up. We have a third-party vendor. We used to be with Anthem. We moved off of that 2 years ago, and we now work with a third-party stop loss vendor. We'll manage that process when we do the renewal. That's a separate renewal process for stop loss, and we'll talk a little bit kind of where we think stop loss is heading. It's another one of our issues. But going to the presentation, so the first page of the presentation, after the cover page, I think we're going to show it on screen here as well.
Yeah, I'm not sure why I think they can see it online. I'm not sure why it's not showing up in the room.
Okay. Do we have copies here? Okay.
Yep.
So on page 1, we talk here about net paid claims. And so this might look familiar from a year ago. If not, I'm going to explain it anyway. When we're talking about net paid claims, we're talking about claims that are up to the stop loss liability. So these are claims that Guilford is liable for. And we break this down by month. What you can see is we go back to 2020 through 2021, up through the current year, fiscal year to date. We show you claims by month. And what you can kind of see, just if you look at it quickly, is we were at, in 2020 to 2021, we were just under $11 million. That jumped up to $11.5 million in 21-22. It jumped up to just under $12 million in 22-23, to $13 million in 23-24. And then last year, you can see a pretty big jump to 14, almost 8 in claims. Again, these are net paid claims. The last 2 columns, you'll see the header column at the top says no FF, that's no firefighters. The firefighters moved off the plan as of last year. so they're no longer on the plan.
We keep getting asked how many people that is.
It was like 29-ish. Does that sound, if it's okay to refer to Mitch. Mitch, does that sound about right? 29?
Left the plan? Yeah, about
29, I think it was. Yeah. Yeah.
Plus dependents?
That was employees, so say 60-ish probably total. Yeah, usually it's about 2.5 times.
That was a year ago, though.
Yeah, it was full, as of 24, 25, so full year. Yeah. And we did adjust the projections for that, so we backed them out of the claim projections for the 24, 25 year. So they're not in the claims, and they weren't in the claim projection either. If it's okay, we'll focus on the last column. What you can see is we started off the year in July, 1.1 million, a little bit higher in August, jumped up in September to 1.2 million. October was a pretty good month, under just over $1 million. And then you can see November, December jumped up fairly significantly to 1.7 and almost 5 million each. Fortunately, January came down to $1 million, so we saw another good month. This is all important because when we do projections, which we'll talk about in a little bit, we're always looking at the most recent 12 months of claims. And what's important to know about that is as we get closer to the effective date, that impacts how many trend months I'm trending forward, and I'll explain that a little bit as well. But what that also does is it's always using the most recent 12 months. So what you can see here, for example, if you look at February 2025, you can see that's a fairly high month at almost 6 million. If February 26 comes in closer to our average year to date or closer to one of our lower months, then we would know that the projections will improve, right? Because I'm going to drop that 1.6 million from the projection, and I'm going to add a better month. Now, it doesn't always work out exactly that way because large claimants have an impact on that. And when I do projections, I'm running large claimants on a 12-month basis. This is looking at them for the plan year. But in general, if you just looked at this page, you can anticipate, hey, if we have a better month than 1.6 million, then we probably would see an improvement in the claim projection next month. Okay. That's really all I wanted to talk about on this page, unless there's any questions. The next page gets, I think, is a little bit more meaningful. So for page 2, here we talk about claims, what we expected claims to be, and where claims are actually coming in at. And so if you look at the top line, you'll see for each of the years, we had 11.3 million for 2020 through 21. That stayed about the same for 21, 22. You all might recall that for 2020 and 21, 22, those were post-COVID years. We did see some reduced claim activity in those years. Some groups saw more significant claim activity than others. We'll talk a little bit about trends in a little bit, and COVID, believe it or not, even though it's not an issue from a claim perspective anymore, it is having an issue, in my opinion, on healthcare costs, and I'll explain that when we get to that point. We did jump up to expected claims of 12.7 million for 22-23, and then just under 13 and just over 13 for 24-25. For this current year, our expected claims is almost 14.9. Below that, we bring in our gross claims. So the prior report showed you net claims. This is showing gross claims. So this would include all claims that were incurred, even those that were over the stop loss level. And then I bring in the amount that's over stop loss so we can kind of isolate that. What you can see, and then below that, I have the plan year differential. So what you can see is in that 2020 to 2021 year, we were $377,000 under expected, or about 3.34%. The next year we were slightly over at 1.66%. We were under in 22-23 about 6%, slightly over in 23-24, and then over by 13% last year. And the next section we're going to talk about is going to explain what happened last year. Currently year to date, let me talk about that column in particular. So we expect claims to be at 14,868,000. If we just do a straight de-annualization, I'm not sure that's really a word, but if you annualize that number, if you take that number, divide it by 12 and multiply it by the 7 months that we have, then we would expect to be at 8.7 million. That's not a real actuarial way to kind of look at claims. There's seasonality to claims. We're almost all HSA now, so employees in the beginning of the year haven't hit their deductible, but they'll hit their deductibles in the second part of the year. So historically, what we've seen with plans with deductibles is the first part of the year is lower than expected, the second part of the year might be higher than expected, then you end somewhere on average at expected. What's really throwing that off now is large claimants. So, and even in Guilford here, what we're seeing is some of those large claimants are hitting very early in the year. And so even though even though the vast majority of employees may not have hit their deductible, we have a lot of claimants hitting the stop loss. And so that is driving those months in the beginning of the year to be higher. What's fortunate about that is once those claimants hit the stop loss, then they're not claim liabilities for us anymore, right? So in the second part of the year after they hit stop loss, they cease to be claim issues for us. So we started to see some cases where claims are actually lower in the trailing months because we have more people hitting stop loss. All that is basically saying, I think the most accurate way to kind of give a just general litmus test on how we're running is to do what I do here. Divide it by 12 and then multiply it by the number of months in the year. So if you look at that, we expect claims to be at 8.6 million, almost 8.7. Gross claims came in at 9.3. We've got $615,000 over stop loss already. So we're at 8.7. We're running about $52,000 or 0.6% over expected at this point in the year. Below that, we report stop loss premiums. And what you can see is we moved to partners, like I said, as of 23, so I said 2 years. So 2 full years plus the current year. You can see our stop loss premiums dropped significantly when we did that. That was part of the RFP. So we did a full RFP in 23-24. We ended up staying with Anthem as our carrier, but we moved the stop loss at that point. So we are in the last year of our 3-year commitment with Anthem, our 3-year proposal with Anthem. There's our stop loss premiums. We'll talk a little bit more about stop loss, but what I do want to point out is last year, for example, our stop loss premiums were $1.5 million. The stop loss vendor paid out $2.5. This year we're paying $1.6 million. I'm projecting we'll be probably higher than that. We do have rate caps generated as part of our deal with the stop loss vendor. It's a 40% rate cap, and I'm assuming a 40% rate cap at this point, and given the losses on where we are. I really like the next section of this report. I think it kind of helps explain things about what's happening. And so here what we talk about is what we call catastrophic claimants or high dollar claimants. And what we define a catastrophic claimant or a high dollar claimant is anybody over 50,000. All right, we're just looking at medical and drugs. There's some argument that we should push that to 75. I don't think we should. I think we should still use 50. We've been using 50 for a long time. And then when you get to see the percentages of the population and the claims, I think it makes more sense to keep using 50. Carriers are pushing to start to look at claimants over 75,000 as catastrophic claimants, but really a $50,000 claimant is still a pretty big claimant, even in this environment. So I'm going to continue to track at 50.
Ask the question about the
Yeah.
RFP.
Yeah.
As part of that, was the pharmacy benefit manager, did you have to go with the same one, or could people just bid on that piece?
We didn't do a separate PBM RFP at that point, nope. So for catastrophic claimants, so what we do here is we bring your net paid claims down from above, right? So you can see in column 1, the 10.9 is our starting point. And if you look at the second to last column, right, we're at 14.7. So that's the net paid claims for those fiscal years. The line below that is how much of those claims were for high dollar claimants. And that's just your liability. So between 50 and the 125. So if we just focus on the last year, I think that's the important year to look at. Happy to go through the other years. But what you can see of the $14.8 million in net claims, 7.6 of that was for high dollar claimants. And the remaining 7.1 was for non-high dollar claimants. On average, we had 1,244 members. So here I'm counting employees and their dependents, right? So we use 2 terms. Contracts would be your employee or your retiree that you're obligated to provide coverage to. Members is that employee and their dependents. So I'm a family of 4. I'd represent 1 contract, but 4 members. Okay, so here we're counting members. We have 1,244 members on average as of last year. 75 of them were claimants over 50,000. So 6.3% of your enrollment was driving almost 52% of your cost. So I'm gonna have you go back up to the top section. We were over projection by 1.7 million last year, right? That 1,689,000. Look at the prior year in the second section. We jumped up 15, 16 claimants. But if you look at the large claims section, right, the high dollar claimants went from 6,064,000 to 7,648,000. So that entire, right, increase in claims over expected was related to those, what you could call new. I mean, some of those could have been current large claimants that had more claims, but it was all in those large claimants. And that's what we're seeing everywhere, right? We're seeing that large claimants are really driving the cost for, not just municipal plans, but in particular public sector plans are really seeing a significant increase in the dollar amounts and the percentages of the population. What I would say for Guilford, you're a little higher than what the norm is that I'm seeing. So in general, what I see is it used to be about 3% of enrollment was driving about 38 to 48% of your cost. Now I'm seeing that's high threes, high 4% of your enrollment, driving between 40 and 50% of your cost. So here you're at 6, driving 52. So I think we do have a little bit more than our fair share of large claimants in Guilford. If I look at the rest of my book of business, it's more similar to your prior year than it is to last year, to 24-25. And then, so year to date, I wouldn't put a lot of credit in this number, right? More people become $50,000 claimants, more claimants are gonna hit stop loss, but just, year to date, 38 members are over 50,000 already, and they're generating about 4.2 million in claims. So, almost half of your claims, again, are attributed to those large claimants. The last line down, what that measures is your non-high dollar claimants. So you see PMPM here, that's a per member per month. That's a per capita. So we take total net claims, divide it by all the members on the plan, and then that gives us a PMPM. Here I'm just looking at those non-catastrophic claimants. And so what you can see in the first couple of years, they did jump up, like they were probably a little higher than trend in those years. But our non-high dollar claimants actually have outperformed trend really since then. We'll see what happens this year. But so it's not a non-high dollar claimant, right? It's not a claimant under 50,000 problem. It's really a claimant over $50,000 problem. Any questions on that page? Next page is very similar, but what it does, instead of comparing the last column to full fiscal years, it just compares every fiscal year at the same point at that time. So I think if we just look at kind of the last 2 years, the current year and the prior year, at this point last year, we were $440,000 over expected, or 5.8%. This year, we're 52,000 over expected, or 0.6. And all the other prior years, we were running under expected at this point in the year.
I do have a quick question.
Yeah.
Just to go backward. Could you explain laser?
Oh, sorry, yes. So what a laser is, and we do not have one in place now for the last 2 years, but we did have one in the first year. So what a laser is a stop loss vendor, and in Connecticut they have to be limited, but what a laser is when a stop loss carrier says, hey, Guilford, stop loss is for unknown risk, right? If there's known risk that's gonna repeat year after year, then we're gonna limit how we're gonna cover that individual. A very good example, not here, but a very good example is hemophiliacs, right? Hemophiliacs can be on your plan. They're gonna be $1 million plus every single year. They can be on your plan for 20, 30 years. So a stop loss vendor would say, hey, we know it's gonna be a continued large claimant every single year. We're gonna put a laser on that individual. And in Connecticut, your laser can be 3 times your stop loss level. So instead of covering that hemophiliac at the you're at 175 now, at 175, they would say that would be a $525,000 stop loss level. So still covered by stop loss, but you absorb more liability. We have a no new laser provision in our contract, so even if there was a large claimant that the carrier wanted to laser, we have a 40% rate cap and a no new laser, so they wouldn't be able to put that laser on that member.
Is there any data, obviously understanding privacy, but is there any data on trends of types of claims? Like, is it mostly hospitalization? Is it mostly mental health? Is it like anything like that?
I have some. In particular, what we're seeing is that our largest claimants are hospital related in most cases. Some of them are prescription related. We can have some very high cost prescriptions, but The vast majority of those new claimants over 50,000 aren't drug claimants. They're not drug claimants. They're hospital-related claimants. It used to be, so I've been doing this as a consultant now for 20 years, and with my former partners, if we had $1 million claimant in all of our clients, that was a big deal. Now I have several clients with $1 million claimants. The highest claimant I've seen not too long ago was $3.3 million. Was an approved claim by the carrier, right? It was a lung transplant with some other complications. So the likelihood of $1 million claimants is much more prevalent now than it ever was. And most of that is related to hospital claims. Where drug claims start to kind of come into play is, I heard a statistic a couple weeks ago, and I hope I get it right, it's 75% of cancers now can be deemed curable. And the way they define that is if 75% of the people with that diagnosis survive for 5 or more years, they consider it cured. Now they're going to live with it, right? But it's cured. And that's 75% of cancers now. And that's great, right? That's really a great thing. But it comes with cost. So, if you're having expensive immunotherapy drugs related to cancer, those can be $200,000-$300,000 a year. And I don't want to sound flippant about this, but the life expectancy now with somebody with cancer is much longer than it used to be. So you might have a cancer claimant that was only on your plan for a couple of years. Now they're going to stay on your plan. All that puts pressure, right, on our high claims. And I'll talk a little bit more about that because that rolls right into stop loss, which is kind of what our issues are. But yeah.
Excuse me, I'm a new member. So
sure. Yeah, sorry if I'm going too fast.
Presentations before, but the rate that we pay the hospitals, is that a reduced rate from the regular rate, or is that something that we can negotiate to be able to?
Great question. So in theory, it's a reduced rate. And the reason I say in theory is Anthem goes out, just like Cigna goes out, United Healthcare goes out, Aetna goes out, and they negotiate contracts with hospitals. And so hospitals really kind of deal with 3 levels of payment, right? They have Medicare payment, they have private insurance payment, and I'll lump Blue Cross into private insurance. You used to not consider that, but it really is. And then there's free care. Right? So hospitals, and I'm making this very more simplistic, right? But hospitals are kind of balancing those 3 sources of claim issues and payment. And so we know Medicare significantly underpays for services. We know hospitals have to give away free care because people go in without insurance. And so what ends up happening is private insurance pays more. So we say it's a negotiated rate, but in theory, the vast majority of private sector or private insured are paying about the same rate. So, the hospital, Anthem might say we have a 50% discount, but in my opinion, the hospital's just inflated the 50%, right? So, and in Connecticut in particular, in other states it's different, but in Connecticut in particular, and it will change from year to year as contracts come up, but in Connecticut in particular, most of the carriers in the state have about the same discount. So there's not one significant discount advantage by any one carrier. And like I said, that can change if Anthem's negotiating with Hartford Hospital this year, maybe they have a slightly better deal for a year until Cigna catches up. That's generally what we see. Connecticut is somewhat of a problem because what we find, we're a small state with a lot of hospitals and really 2 major health systems, right? Hartford and Yale. And one of the issues that we have in Connecticut is employers, especially in the public sector, but employers don't want a carrier that doesn't have every hospital. Further, to complicate that is because we only really have 2 major players, if Hartford Hospital is not in your network, it's not like it's just Hartford Hospital, right? It's Hartford Healthcare is not in your network. That used to just be, okay, a handful of hospitals, not even a handful, a few hospitals. Now it's more like a handful of hospitals. But now they've gone out and bought a lot of physician practices too. So while they're separate contracting, typically if you're gonna have Hartford Healthcare come out of your network, you're probably losing all the hospitals and likely all their outpatient centers and likely their providers as well. And so it exposes, right? It would limit the size of a network. So we're in a state where really all the carriers need to have all the hospitals in order to compete with each other. And I don't think that does a whole lot of good for the pricing. I grew up in Michigan. Michigan, there's a lot of hospitals, but it's a big state. And there's several health networks. And so Blue Cross in Michigan can say, hey, we're going to participate with Corval Health, but not with St. Joe's, right? And because they're 3 miles from each other. So it's not like I'm losing access to a hospital. And so the competition's a little bit different. And I think that is a little bit of an issue here in Connecticut.
Insurance companies, Connecticut went away,
Connecticut
Harvard
went away for
Pilgrim
the
went
most
away, so you're left with like 4 choices.
Yeah, and really, I mean, it's Cigna and Anthem that are the players in the public sector. Aetna and United have made an attempt to get into the market, but really haven't been all that successful. It's really been Anthem and Cigna that it's 99% of the market. I mean, it used to be Anthem was 95% of it, right? But Cigna's picked up quite a few. So that, I don't know if we need to go through page 3, but that's just what that is. So it just shows you kind of everybody year to date. Oh, is there an extra page in there? Oh, no, that's, sorry, I was behind the page. Okay, so what I brought in, and I did this for you guys last year. I was having a conversation in the back about, fully insured versus self-funding. So the difference between fully insured and self-funding is, the easiest example is, if we were fully insured with Anthem, they would hold all the claim liability. We would pay them a premium. It would be a set premium. So if our premium was $12 million, it'd be $1 million a month. Whether our claims were $8 million or $15 million, we only pay Anthem $12 million. We would pay Anthem $12 million. In those cases, if we outperform projection, then Anthem keeps the money. Now that would roll over, like that would be part of our projection for the next year. Yeah, it would show up. It's not retroactive. There are some fully insured plans that work that way. Let's not get into that. But for the most part, the carrier eats losses or reaps the surpluses. And then when we do the rating, it says, hey, they had a good year, so next year's premium doesn't need to be as high as it otherwise might have been, right? So it's a retrospective rating process, a prospective rating process that takes into account retrospective performance, okay? So in my opinion, when you look at, a group your size, with your fiscal responsibility, comparing a fully insured to a self-funded group, you're going to pay, on average, 14% more for your exact plan if you were fully insured, right? And so one of the things that we look at is, well, how have we done in managing claims, right? How have our claims been? And clearly last year was a bad year from a claim versus expected perspective. But if we look, this is just showing us our expected claims over the years. And I added, so I did a slide for you guys last year. I added the 25-26 year, which jumps up. So what you can see is just kind of over time. So for 2016-17, our claims were expected claims were 13.2 million. So this goes farther back than the reports. For 24-25, that completed year, we were 13 million one. So our claims were actually lower in 24-25 than they were in 16-17. So our 24-25, I kind of summarized it there at the bottom, was $135,000 under 16-17 or 1.02%. There's not a lot of groups that can say that over 9 years, right, that your claims actually went down. If we were fully insured, right, in those years that we outperformed projection, then Anthem would have kept those funds. Our expected claims would have readjusted, so I'm not trying to say it would be exactly that, but one of the reasons why groups your size tend to be self-funded, right, is that you want to take advantage of those years where you're outperforming projections. Now you can see last year was a bad year, right? So we jumped up to that 14.9 million, which was up 13.51% in the projection. So what you can see, right, is if you compare projected for 25-26 to 16-17, we're up 12.36%. But 12.36% is not too far off of where trend is for this year, right? So over a 10-year period, to be up 12.36% in expected claims is I think is pretty good. A lot of that you have to give credit to your boards, your board of selectmen, your board of education, who've negotiated those contracts, right? One of the ways that you can impact your cost is through trend mitigation, and trend mitigation would be how do we kind of control trends, and one way is through plan designs. right? So all those negotiations that the Board of Ed and the Board of Selectmen do with unions and tweaking the plan design, take a little bit off a trend, a little bit of trend mitigation. We don't get 12% trend mitigation in any one year, but over time, right, we get that trend mitigation, and that helps control the cost of the plan. And just note there, right, for 1920 and for 2021, those were our COVID years. And so in 1920 in particular, right, April, May, and June claims dropped significantly because the healthcare system was basically shut down for elective procedures. We saw that carry on into 21, 22 as well. And then we started to see things pick up again. And I'll talk about a little bit more about that in just a second. Any questions on that one? Okay. How am I doing for time? All right. Rating trends. So, I'm sorry, market factors. So kind of coming into this cycle, folks like me, my colleagues and I, knew it wasn't going to be a pretty year. And so I put this together to kind of explain what the 26 market factors were going to be. So for rating trends, so we use annual trend as part of our calculation. Annual trend is basically the medical inflation factor. And I keep saying annual trend for a reason, because on the next page I'm going to talk about an applied trend, which is different than annual trend. So we kind of basically set three different trend expectations. A low or aggressive trend at 9%, mid-market, what I expect Connecticut to end 10.5 to 11.5, on a conservative basis 13, and that was all averaging out to be about 11%. In the beginning of the year, we were actually expecting to see medical trends higher than drug trends, and that was for the first time in a very long time. My most recent data from Anthem is they've come off of that, and drug trends will be higher than medical. And actually, we're kind of moving towards the low aggressive as opposed to the mid-market. So you've got a higher trend environment, right, than we've had in the prior 4 or 5 years. 4 or 5, not 45, 4 or 5 years. On top of that, many public sector groups like yourself for 24-25 ended over projected, right? So super easy math you can do in your head, right? And it's not going to be always accurate. But if you're in a 12% trend environment and you were 3% over expected last year, then you're going to look at a 15% increase for the following year, right? So 12% trend on top of whatever you were doing worse than. Now, we don't do the projections at the same time, so it never works out that way, but that's how the market can kind of look at things, right? How much over expected were we in any one year, and what were the trends for the next year, and that will kind of tell us how we're performing. So that's kind of how we're seeing groups end, right? I'll get that to the bottom, but we're kind of seeing that over expected plus this 11 to 12% trend is kind of where we're seeing average increases come in. What are the drivers of that? So what's driving that? We already talked about increasing catastrophic claimants, those numbers over 50,000. That seems to be currently driven by mostly hospital claims. And so, like I have here, you're higher, but many of my public sector clients are 3.5% to 4.5% of their enrollment driving 40 to 50% of their claim costs. You guys were higher than that. So I said earlier, we had low years, right, where claims came in way under expected because of COVID. I know that what we're seeing now is an increase in high claimants. Seems to be a combination of more large claimants, so more people getting sick, but also higher unit cost, right? So those same people who were sick before, who were $30,000 claimants 3 years ago, are now $50,000 claimants, not because they're any sicker, but because claim costs have gotten higher. And what it appears to be happening is it's more of a unit cost issue than it is a new member issue, right? And so even though you jumped up 10 members, that doesn't mean you had 10 members get sicker last year. It just means their claim costs may have gotten higher. So I think a lot of this is still COVID related, right? And the reason why I say that is hospitals took a bath during COVID, right? They had very expensive claimants when they were coming, or patients when they were coming in, and they weren't getting any elective procedures, right? And so hospitals are really kind of taking it on the nose. They were very clear about that, and since then they've been looking to make up for losses during COVID. And that's why we're seeing increases in hospital payments. So I kind of feel like a lot of this is still can't blame it on COVID itself, but it's COVID era issues that are impacting pricing today. Stop loss is an issue. So as we have more claimants going over stop loss, that puts pressure on our stop loss premiums, right? That's why we negotiate things like no new lasers and 40% rate caps. So we put those things in place to protect us. The problem is, we'll shop it again. We have a 40% rate cap and no new lasers, so I don't want to tip my hat to any carriers that might be listening. As likely we will stay with that vendor, right? Because I don't think we'll do much better than a 40% rate cap. But what that probably means is we won't have a 40% rate cap on the table for the following year, right? So we'll have to try to negotiate that, or that's the year that maybe we can make a move. One good thing about having third-party stop loss is we can move that without impacting the plan, right? So we don't have to change carriers. It's not an issue for employees. No hospital changes, no doctor changes, right? Stop loss vendor has really zero impact on the employees. So it's a fairly easy thing to do. Talked about it already. We're seeing a much higher prevalence of $1 million plus claimants. In some cases, I'm seeing stop loss driving 20 to 50% of the overall increase. Not overall costs, but the overall increase, right? It's just because of stop loss premiums. Overall average increase is expected around 15%. I've got a couple that are 20+%. I've got one that's 2.5. But for the most part, we're seeing groups come in right around that 15% projection range. Just some potential factors that would support using the lower position, the 9%. Again, some national data sources, and I'm seeing this now with Anthem. We think the hospital negotiations have kind of gone through, so that should moderate a little bit. Doesn't mean the claims are going to costs will come down, but they shouldn't be increasing at the level that hospitals were demanding. And then in public sector, we're always first, right? So we're the first to get those more large claimants. We're the first to kind of see those bigger claims. And so generally, when you see a high utilizing market, it tends to trend at a lower rate, right? Because it's not experiencing as much newness as other markets are. So there is some argument to use the lower aggressive position. Questions on that? Okay. So currently, our initial budget projection, which I'm sure you've seen or heard or it's in numbers that you're going to be looking at tonight even, this is kind of our initial projection through November. We have looked at updated claims. There is some improvement in that through discussions with the management. I think right now, especially because January is such a low month and we're coming off of 2 very high months, we would prefer to look at February claims and see how that impacts the projection before making any significant changes in the budget now. But that would be my kind of guidance at this point. I always get a little nervous when I see one really good month following 2 bad months, right? That's not scientific, that's just personal. So that's kind of where our position is right now. So we're sticking with the November projection. The way this, and I'm just showing the claim modeling here, there's the fees part we're not showing because the claims are what's really driving the majority of the cost here. And so most of the work happens in 2 of these boxes. So the top box is what we call the experience period data. Middle box just kind of talks about our large claimants. And then the bottom box is how we model the claim projection forward. So I'll walk through it real quickly for you. The first thing we're going to bring in is our gross paid claims. So those are all claims, even those that are over stop loss. And then in the second line, you'll see a negative, right? So if we look at the last column, we had 17.6 million in gross claims. That was up 18.33% versus where we finalized the current budget, 25-26. Sorry, I should have said it first. So column 1 is the current budget year, 25-26. Column 2 is the projection, the initial projection for 26-27. You'll then see I back out in the second column $5.9 million. What that is that's any claimant that's over $175,000. I'm backing out all of their claims, not just the amount over $175,000. So if Joe's a claimant, he's at $350,000. I'm going to back out all $350,000 for Joe, not just the $175,000 that's over your $175,000 stop loss. But what I'll do is I'll add Joe back in at the bottom, but just at $175,000. The reason why I do that, if I only backed out claims over $175,000, then in theory, I'm projecting forward claims into stop loss, right? So if I backed out for Joe, right, if I backed out 175,000, I kept 175,000 in, and in 10% trend, I'm projecting $18,000, right, into the projected year, which would be over stop loss. So we back everybody out and then add them back in at the end. And then there's also some other reasons why we do it that way, and I'll show you in a second. So then we get a claim base that we're going to base our projection off of. That's 11,000,007. On average, we have, over the running 12 months, so experience period contracts, we had 6,067 contracts. That's counting every active employee once for every month they're on the plan. Okay, that's why that number is so big. So if you divide that number by 12, you'll get close to our average of 500, right? That's what that number is. I then create a per capita. So what you can see is my base per capita is at 1930. That's up 8.05% versus the prior year. Second box, we just talk about large claimants. And none of this will tie back to the reports because this is a running 12 months now, right? I'm looking at a running 12 months. So you can see my claimants over 50 jumped from 66 to 71 and from 8.5 million to 10.3 million. And that's just your liability. Of those that are over 175 or would trend to be over 175, that's the 5.9 million that I backed out above, right? So I'm backing all of them out to add them back later. That's on 21 members. So I've got 1,000,007 more that I'm backing out, right, and 7 more members. And then actual excess in that 12-month period, if our stop-loss contract was a 12-month period, we had 2.3 million in excess claims versus 1.6 on 2 less members. So actually we had 2 less members that were actually over stop-loss. And then what I have to do is add back those 21 members, right, at the 175,000, and that's where that 3.675 comes in, okay? So now to do the claim modeling, what we do, the first line you're going to see there is trend months, and that's a very important number. So I said earlier, right, looking at claims each month, we can kind of make a determination, hey, if February comes in lower than the 1.6 million, then we expect some improvement. Well, we see improvement for 2 reasons. One, because the claims improved, right? I'm going to use a lower 12-month base, but I can also use less trend. So what trend month does is that's telling you how many months I'm projecting forward, right? So we use annual trend, right? We talked about that already, but I'm not ever predicting 12 months from now. I'm always predicting some further amount of time for that, right? So for example, in November, I'm taking November 25 claims and trying to make them look like claims all the way through June 2027, right? So I can't use an annual trend. I have to use an applied or an effective trend. And so the easy way to think about that, although there is a formula to get to it, but the easy way to think about that, if annual trend was 12%, you can assume trend is 1% a month. Then if I'm using a 19-month trend, my applied trend would be 19%, okay? Again, it wouldn't exactly be that way. The other thing you could do is you could take my 9.1 divided by 12 and then multiply it by 19, and you get pretty close to that 14.8, okay? So I'm going to take that per capita. I'm going to take my 9.1. So we are already in Guilford, we've already decided to use the lower trend, right? So again, my first slide's that low aggressive trend. We've already decided to do that. We're using that 9.1 trend on a 19-month basis. That would be just under 15%, 14.8. So I take my 1930, I increase it by 14.8%. My new per capita is $2,200. If we had a reason to add margin here, we would add margin. We really haven't. When we've added margin in the past, I think the last time I've ever added margin just across the board was when the Affordable Care Act first passed. We really weren't sure what's the impact on preventive care at no cost, what's the impact of having children to age 26. So we had, I think it was about a 3.5% adjustment just to give us some margin in case claims really picked up. The other time we might use margin if Matt told me, hey, Joe, we're going to hire 35 new employees. We don't know how many are going to take the insurance, but let's make some adjustment for it. We might add margin. The opposite could be true too. Hey, you would never lay off 35 employees, but we're going to have 35 less employees on the plan. We're not exactly sure how many. Let's make it a margin. So you see a negative adjustment here. Okay, but so we're not adding margin. The reason I keep it in there is I want people to know that we're not adding margin, right? It was a straight projection. So we got our per capita. We're going to increase that by our current contracts. So those are contracts on the plan as of November. We're going to project that forward. That gives us a base claim projection of $13,500,000, but then I have to add back that 3.675 million of those claimants that I pulled out of the top, right? So I'm adding back those 21 members at the $175,000. So I'm adding them back in, and then you'll see a negative 350,000. So one of the reasons why I like doing the projections this way, taking out all of the large claimants and then adding them back at the end, is it gives us a little bit more flexibility. I mean, we could do it other ways, but it gives us a cleaner way, is we know through November that 2 of our claimants are no longer active on the plan. And so we can talk about that and say, hey, do we think 2 people will take their place? You already have a lot of large claimants, right? We found that out from last year. And so do we really think that removing 2 people, there's exactly 2 people will take their place? So we've talked about that, and we've opted to say, hey, we think those 2 people, no one's going to take their place. We already have a lot of high claimants. Let's remove them from the projection. So what I do is I'm adding the full 3.675 back, and then I'm removing 2 members at $175,000 each. That's the 350. That gets us to a claim projection of almost $16.9 million. There's a slight adjustment here. You see 0.9846. What we're seeing in Guilford is that your membership, the ratio between contracts and membership was changing. And so when I run projections, I do them a bunch of different ways. One's contracts, one's members, some other ways that I do it. And what I was seeing is I did it by members, it was generating a better result. Because spreading the member per capita, there was more members, so the per capita was smaller. So that adjustment just reflects that change in member to contract ratio. Okay, it's not just an overall adjustment. There's a reason why we did it.
I had a question.
Yeah,
Do employees pay premiums?
they pay a portion on average, probably about 20%.
20% average.
Yeah.
20% average, okay. And this is the high deductible plan, right?
For almost all employees are on a high deductible health plan.
Okay.
All now.
All now.
Oh yeah, right, all now.
High deductible plan is gonna be about $4,000 deductible to maybe $5,500 for a family?
$2,000 for a single, $4,000 for a family.
And the board-
Two-person counts as a family, by the way.
Two-person.
It's a family.
So if I multiply 509 roughly.
That's for the town side. I can't speak for the Board of Ed side, though.
Okay.
Deductible is $2,250, $4,500.
Yeah.
So slightly higher.
My numbers are giving me that they're about $2 million in
Contributions.
contributions. Where are they taken in consideration here?
Oh, so, yeah, good question. So that's where Mary Jane and Linda come in. So I give you total cost of the plan.
Okay.
Right? Here's what I think the plan is going to cost. And then we let Mary Jane and Linda figure out, okay, well, how much revenue do we have to offset that? And so your revenue sources are employee contributions, their retiree contributions for the Board of Ed in particular. There's some state contribution for retirees that we get through the Teacher Retirement Board. So there's a revenue line, I'm sure, somewhere in their budgets that shows those offsets. Yeah.
I'll just explain that. You know, we start with the projections, and the work that we do on our end brings the amount that we see in the budget different to the exact amount that Joe is presenting, and that's because we're making all of those deductions.
Offsets.
The impact of taking the firefighters, and then I think there were a couple other members recently that left. Six that went to a different plan, and how that's impacted this.
Yeah, so for the firefighters, and I don't remember the exact numbers, I don't have them here, but the way we did the projection when the firefighters left the plan is we could isolate them, right, because they were in one subgroup, so we just removed them completely from our projection. If I remember right, the amount that we removed was greater than the amount you were paying for the firefighter plan. So it was a
win.
Good move. It was a win to do
But it's
that.
not a win for the healthy pool of people, right?
Well, it's a smaller risk pool,
It's
yes.
a smaller risk pool, so I guess that's what I was asking, like, the pros and cons of that. And then I think, yeah, 6 other people left, so you keep reducing the pool, there's not as much risk to spread around.
Yeah, so that's the analysis that we did. Like, we spent a lot of time looking at that. Like, was it detrimental to lose the firefighters? And it wasn't, right? So it didn't drastically impact the overall cost of the pool. The 6 that you're talking about, It's not a consistent, so it's not like this subgroup. So we can't really isolate, because I don't know member claims, right?
Okay.
Like I can easily find out how many claims did Town Hall have, because it's a subgroup, but I can't say how many claims did Matt have, right? I can't find that out.
Well, Megan, the Board of Selectmen did take a reduction, an estimated reduction on what we felt those 6 employees would represent, so we have done that.
That's reflected.
With the self-funded plan, is the healthy versus non-healthy people, is that less of a concern? Because you're not going out to Aetna or Anthem or whoever and saying, here's our pool, you're just basing it on whatever claims we've had?
Yeah.
Or is it still a consideration for all the negotiations with the hospitals?
Yes, so, yes, claims is what drives all your costs. So for example, if Paul says to me, hey, we're gonna have 30 less teachers next year, what should we do for the budget? It's very hard for me to know, right? If those 30 are all large claimants, then the budget's gonna go way down. If those 30 are not using the plan at all, then the budget's not going to change at all, right? So it's really hard to do that. So we do some modeling in those scenarios. Generally what I would say, and I think it's kind of what Megan was saying, is as an underwriter, I like consistent pools, right? So whenever we change the pool, I always get a little bit nervous, right? Whether we're adding people or taking people out. And so, a geeky underwriter says, hey, if we can keep the same amount of people in the plan all this time, right, then it becomes much more predictable. And I'm less likely to have swings. But that's not reality.
And
So-
the administrative cost isn't affected by...
Not significantly enough,
Okay.
right?
It's just
So,
when you're going out to bid.
Right.
yeah, I mean, if so this comes up a lot when we talk about waivers, right? And you guys have waivers here where you pay employees not to take insurance. Employers that don't do that already will talk to me. Hey, we want to offer a waiver to our employees, right? Let's price that out. And that's very difficult for me to do, right? Because when you're factoring the cost of a waiver, that's not paying a waiver today. So first of all, you have employees that are already waiving it, you're not paying. Now I got to pay them, right? Those employees that weren't waiving but now want to waive, I'm going to pay them to waive and also lose their contributions into the plan. And I don't know if those employees are incurring any claims. And likely what we find is typically that in the public sector, and it's not as true anymore, but your plans are more generous than a private sector plan. So our assumption, and it just is that, maybe it's a presumption, our presumption would be that if an employee is going to opt out of your plan and go on to a private sector plan, they're probably not high claim utilizers, right? Because your plan's more generous. Now that doesn't necessarily always hold true, but so it's really hard to tell. So that's why as an underwriter, right, I like, hey, let's keep the population the same all the time. Now, of course, we do the math on scenarios like the firefighters, and it made sense to do that, and it didn't have a significant impact on the overall pool. And we did look at that in particular, like what would that do to the remaining pool?
It's just going to be when we have to go out for another RFP, right?
No, because they're going to look at the most recent 12 months at that
Okay.
point. Yeah, they're not going to look at anything beyond that.
And we are locked in to Anthem for the pharmacy benefit manager for this year.
Yes, yeah.
Okay, because you
Yeah,
mentioned that.
Technically, we can leave, but there's money on the table that we can leave.
Okay.
Yeah.
But that could be an area of opportunity to go out to bid and decrease some cost if we didn't go with the same,
We split it out.
we split it
Yeah,
up.
yes. So there's opportunities to split out stop loss, PBM services. Yes, all those are options, correct. And then just last page, next steps, continue to monitor claims and revise projections as needed. So stop loss, I didn't go into this, sorry, real quick. We won't lock stop loss in. Typically, a stop loss vendor is not going to lock in pricing until they see March claims, which means I'm not going to see a number until April that we're locked in at. And then, we'll look to the market there. I don't anticipate we'll move because I think the rate cap is probably going to be our best option at this point. And then, obviously, the state partnership plan is something that we know is available, and we analyze that on an annual basis. Just to kind of speak to that real quick, the state's not immune to these same problems. State's currently projecting between 12 and 15%. The state has also had a lot of pressure on their reserves. They're running currently at an $18.5 million deficit as of 24, 25. And their premiums are lower than claims. So state is addressing that in their increases, so that is an adjustment that they're making.
But it's not a high deductible plan, so the difference
Yeah,
is, it's a point of service plan.
Oh, I'm just saying that the same claim pressures
Yeah.
are on the partnership plan, on all plans really, but they're faced with those same, the state's not immune to it.
But different type of plan, if you're looking at retention of
Yeah, no,
employees.
not speaking of plan design at all.
Yeah.
Yeah, just the claim cost.
Joe,
Yes,
thank you.
you're welcome.
I didn't know, I believe, are you all set with your presentation?
I am.
Can I ask a question about, so the governor's budget?
Yeah.
Sorry, Mike. In the governor's budget,
No.
there's a proposal to put together essentially like a public option committee to open up the state plan to small businesses, nonprofits, all that.
Yes.
How would that impact Guilford's situation? Like, let's say a public option did happen out of that work group. Let's say it passes in the amended budget, the work group gets together and they figure out a way to open up that state employee health plan to small business and nonprofits. Do you have like any sense of what that would do to towns like that, us that are self-insured?
I can't foresee a reason why it would impact groups that aren't in the partnership plan. How they segregate it within the partnership plan would be interesting to me. I would guess that the rating would be different for non-public entities than it would be for public entities.
Okay.
But I don't know. I don't have any say on that. I know they've talked about it in the past, and I think that was the proposal before, is that it would be rated separately. It wouldn't be.
Okay.
That's my understanding.
Yeah.
You might know more than me. But that's my understanding. But I don't think it would have an impact on non-partnership clients, groups. What's more interesting to see what happens with UConn.
Yeah.
It's not a big driver for us here in Guilford. I mean, Yale is really our driver down here. But it'll be interesting to see what that does and what that does to the market, if that has any positive impacts on pricing. I really don't know what that's going to look like. Yeah, I'm very curious to see what happens with that.
Sorry, Mike.
No, it's good. It's fine. I just wanted to make sure that, I know there's other elected officials that are in the audience from the Board of Education and from the Board of Selectmen. I know the Board of Finance members have been peppering Joe with questions. So I'm just wondering if anybody from the Board of Ed or Board of Selectmen have any questions for Joe while we've got the opportunity right now.
Not a question, Mike, but this seems to be the conversation we have every year. And Joe, thank you for including that last bullet on the thing, which is to monitor and analyze rate setting for the state partnership plan. So I think this is the time that we actually put a group together that studies it. We're not going to put it all on you. I think representatives from Board of Education staff, the Board of Selectmen staff, a Board of Ed member, a Board of Finance member, and a Board of Selectmen member, and yourself, if I could be so bold.
Sure.
And actually put this together so that we're not sitting here at the same time next year saying, well, we didn't look at the options. So I think it makes sense for us to do that. I'm committed to that. And, well, who's the member that's not here? Sue's here, so anyway. But I will take it upon myself to make sure that happens.
Yeah, and to be clear on that, when we've done the analysis, we've done that analysis, I think 3 years in a row and prior during negotiations. And that's been a thorough analysis, just been more with Linda, Mary Jane, and Mitch, right?
Yep.
But yeah, so a bigger group is fine.
Appreciate that.
The one thing about this partnership plan is it's a fairly easy analysis to do.
Right.
right? The biggest factors in doing that analysis is where is the final rate going to be with the state, which is held steady now for two of their updates between 12 and 15, and then where are we going to end, right? So those are the moving pieces, but the math part's easy, right? Because it's a fixed rate. So we don't have to worry about what the state rate's going to be. It's going to be whatever that fixed rate is.
Thank you.
Joe,
Yeah.
I spoke to Joe before. The question comes up, what if we did a cooperative with 3 or 4 neighboring towns?
It's a
Would there
MIWA.
be any benefit by changing the pool? And you gave an answer,
I know all
which I
about
thought
this.
made
I just did
sense.
this.
Yeah, so the state, there's a public
There's
act.
a state MIWA.
But the
you can
state
make your
Public
own.
Act, 98-174? 98-174 allows municipalities to come together for health insurance purposes, and specifically states that it won't be a MIWA.
Right.
But it is a MIWA. There are a few collaboratives in the state already. Most of them are kind of run by the RESCs in the area. So ACES, EastCon, ECHMC, which is Learn. I think there is a small, what's the northwest corner?
EastCon.
No, the northwest. Advantage. I think they have a small one. So that's where we've kind of seen that. CREC was doing stuff with stop loss for a while. So that is something we can look at. One of the things that we see with those collaboratives, and I do work with one of them, is how you're structured. So they're all structured a little bit differently. Some are self-funded groups that come together, they're all liable for their own claims, and they're really just collaborating on stop loss. Others are, hey, we're kind of all in this together. We don't all pay the exact same rate. So there's different ways to structure those. What we did talk about a little bit, one of the things that I always see in all of those collaboratives is, wasn't my fault. Yeah. It's Madison's fault.
Yeah.
That's why our increase is 15%.
We just did this and it wound up, everybody has to be okay with the fact that like 1 year it's gonna be like, we're taking the hit, and the
Yes.
next year, you just have to be okay with not always having a good year.
Yeah. I do think that for self-funded groups, looking at stop loss collaboratives could be helpful because it's such a big portion of everybody's budget now. And if you can go into that, I mean, to be honest with you, 10 years ago, we were basically pool rated with all of Anthem's clients from stop loss perspective. They've changed that now, but right, if we found some like groups that had a similar philosophy, we could just collaborate on stop loss. That way, hey, our claim liability is our claim liability, and then we're going to share some risk on stop loss. That could be something that wouldn't be all that difficult to do.
It's not a bad idea.
Any other questions from anyone in the audience, elected officials, or Board of Finance?
I have one, and I'm not really sure if it's for you or for others, but are we using all of the available resources for education or pricing transparency for the members in the plans to know the difference between urgent care and emergency room or prescription types or things like that? Because obviously that drives a lot of
Yes, but I think engagement's always hard. So there's communication that goes out, especially, it's been years now that we've been on HSA plans, so we spend a lot of time in HSA education talking about urgent care, walk-in, emergency room. My number one rule is, if you can, always avoid a hospital-owned facility. It's gonna be a lot less expensive if you go somewhere else, whether that's a walk-in center, that's a lab, that's x-ray. Anthem does some communications. We do have a wellness budget that we do wellness education on. I think we do have a problem where, maybe only a quarter of the people are looking at stuff that we send.
Do you ever do like employee-wide trainings? I know that we found that helpful. Like we even broke down the pharmacy, like if you go to Stop and Shop versus CVS, like we just do like twice a year in-person trainings with staff. And it seems like that's helped.
it's something we could easily
Yeah.
do. We have not done that.
No, yeah, because that, I mean, our staff took that, they were like, oh my God, I'm going to Stop and Shop for my prescriptions because I didn't know I could do that, like.
Yeah.
And you have no idea if you're not the one,
And it
if it's
was-
a deductible,
it
it
was
doesn't really
cheaper.
matter.
Yeah, and I think, offering those types of things isn't difficult. It's encouraging people to come, but
Get food.
if you even get a few.
Bring
yeah.
food, they'll come.
Right.
Thank you.
The town does a big, Mitch.
sorry.
Oh, sorry. The town does do an employee benefit fair every year, which is well attended, and they do bring food.
But we do
Free
it
food.
specifically on, like, you would come in,
Yeah.
like, our broker comes in and literally walks through, like, what Amy's saying on the sort of like urgent care hospital side, and then does the same on the prescription side, and it's helped a lot.
Yeah, I think that makes some sense to do, because it's really been a while, because we haven't had, we were doing HSA sessions kind of annually for 2 or 3 years in a row, and it's been a while now, because people are kind of used to those plans, so, and maybe new employees haven't heard that, so I think that's a good takeaway.
So one of the things with going to a high deductible health plan is it does put some of the burden, if you will, and some of the education on the individual, because they're looking at all the time at what their deductible is. And so they're usually hoping not to reach or not to spend out of pocket, so they usually are looking for what they can do less or expensive. And then if they do hit the deductible, at least on the town's plan, prescriptions are tiered based on, generic brand or non-brand. So
Yeah.
it's giving people the incentive. We feel the HSA,
But
one of the
it's-
reasons why the
yeah.
HSA was less expensive to start in the high deductible plan was because people are looking at their own expenses
Yeah.
because it is coming out of pocket.
But it's even beyond that, like, I learned this year, like, you can still be a generic that you get filled at, like, not a CVS, and it's still, it's even cheaper.
Yeah, good
So
point.
it's just stuff like that
They're options.
nobody's gonna take the time in their busy life without a training to learn.
When they're sick, when
Yeah.
when you need.
Right.
Yeah.
Yeah, I think it's a takeaway we can discuss. Yeah.
Okay, thank you. I know we have quite the agenda tonight, so Joe, I can't express our appreciation enough for you coming out tonight and talking about all of this, about the insurance. And I'm sure if we have any other questions, we'll bring them to your attention.
Great, not a problem. Thank you.
Thank you very much.
Take care.
Thanks, Joe.
Okay, moving on to item number 2. Public forum. Anybody wishing to address the Board of Finance in public forum? I'm going to say hearing none. I'll let my eyes on the table inform me otherwise if there's anybody, but I don't see anybody coming up to the table, so I will move on from public forum if there is none. Item number 3, approve minutes. We have 3.1 Board of Finance minutes of January 20th, 2026. Do I hear a motion?
So moved.
Any comments or corrections? I will just mention there were 2 that I saw. I believe at the very beginning of the meeting, I didn't see a call to order in a time. I'm pretty sure it's somewhat, for record purposes, needs to be in there, so I didn't see a call to order in the time. And then under public forum, I believe it's probably Moffett Road,
Yeah, MA.
but the spelling on that needs to be corrected if I'm reading that correctly. I don't think there's a Moffett Road. And that's it. Anybody else have any other clarifications in the meeting?
I have one on page 3, at the top of it.
Okay, nothing else?
There's one, just one.
I have one on page 3.
Go ahead.
At the top it says gold course revenue is low. I think that's golf course. Unless there's a...
Worry about that insurance.
I knew there was gold there. All right. And then the next paragraph down says, Malfeasance said the town is about half spent halfway through the year. I'd say about half of the expenditures have been spent halfway through. That's all I had.
Okay, thank you. Any others? Okay, call a question. All in favor of the minutes?
Aye.
Aye. Any opposed or abstentions? Okay, great. Moving on to item number 4,
Mike, did you
correspondence. I'm sorry?
Did you abstain? You weren't here. You weren't here.
It's good. It's a little bit hard to see. Item number 4 is standing building.
Okay.
Yes, you abstain.
Okay, got it.
He abstained. The answer is yes.
I don't know. I'm realizing being on video or virtual here, it fades in and out, so it's kind of hard. You got to really speak up from the table. Of course, everybody's known this probably virtually for a while now, but in this position, I'm trying to hear you all. So,
I tell you that every month.
4.1 standing building, there are 2 sets that we have in front of us. There was a special meeting from February 10th, and there was another set, and that was from January 6th, the regular meeting. Are there any questions or concerns? And I am going to mention that this evening, I did reach out. I know there were some questions about the police department needs assessment study. I reached out to Mr. DeMeo, the chairman of the building committee, asking him if he was going to attend tonight. He instead wrote me an email about I guess about a special meeting that was held last night. I believe it was last night.
Yes.
Regarding that study. It's my understanding that a lot of what took place was an executive session, and therefore I want to go through that email in more detail. I have not had a chance to do so, but there is an update regarding that. I believe Matt and Mary Jane were part of that meeting. If they want to comment on it, that's great. Otherwise, I could do a summary at some later time and not tonight.
It was entirely an executive session, so I choose not to speak. Thank you.
That's fair. It basically was a discussion about the study and possible decisions, but no decisions were made, and it was all an executive session. So I will provide feedback on that more. The only thing I can probably tell you is that there is an intention that there will be more discussion, probably more in a public realm, not an executive session, in March. So for right now, that is just in discussion, executive session. Is there any other questions that anybody has on the standing building?
No.
Hearing none. 4.2, pension committee. Anything for pension? We have all the reports, the advisor's report, synopsis, and also for 4.3, we have OPEB minutes in the monthly report. Anything on 4.2, 4.3 before we move on?
No.
No.
Okay. Hearing none.
No.
Item number 5, review and accept the report of expenditures for Board of Education for January 2026.
Good evening.
From what it looks like, it's Ms. Trudeau and Mr. Del Ventura.
Hello.
Good evening.
All right. January financials as reviewed in our Monday operations meeting as well as our regular meeting. Expenditures for the month were $8,510,710.50. Expenditures and encumbrances through the end of January were 55.49 of the budget as compared to 56.70 in 2024-25. Revenue was $35,971.59. That included $1,048.29 for non-tuition, non-resident tuition, $26,345.50 for pre-K tuition, $8,577.80 for Medicaid. Our salaries were in line with the prior year. Expenditures for the month were higher due to 3 payrolls in January. Employee benefits were in line with the prior year. Purchase services were lower than the prior year. Our annual payment for $444,520 35 cents for the energy performance contract was paid in January. Tuition was in line. Supplies and materials were lower than the prior year. The credit in the athletic supplies line is due to reimbursements from the student activity account for purchases made with the district credit card. Our capital was lower than the prior year, and transportation was higher than the prior year. Our non-lapsing education account reflected a current balance and interest to date, which is $803.71. Our warrants totaled $2,862,238.66.
Thank you. Questions? Linda, I know that you sent the tuition report. I did not have a chance to look at it. I'm sure others on the board probably did. I don't know if you want to review that very quickly, the tuition report, or if anybody has questions on that before I forget it. Usually I forget about that.
So there's only a slight change from last month, about $60,000 just of, changes in final costs or cost estimates. So we're still at an estimate of being $417,370 under budget. We haven't had any changes in the past month for outplacements. There could be a couple potential on the horizon, but at this point, we're still kind of holding pretty steady.
So that change from last month was just a result of what? Reports coming in?
Yeah, some estimates. We had a change of a student, and the final bill was less than we had anticipated. And well, actually 2 students, and one of them was just slightly higher than I anticipated. It ended up being a little bit longer time period than I originally was told. So it's like a $60,000 difference from last month.
Right.
Other questions?
Yeah, other contracted services is
Hi. Is there anything going on there? Or is that just timing?
It's just timing. Most of those are annual payments, and then there's the rest of it's just a timing factor.
Yeah, largely in line from last year.
Yeah, it's not anything unusual in there.
Okay.
Any further?
No.
Okay. Well, that'll be a quick discussion tonight. So good. I will entertain a motion to accept the report of expenditures for the board of ed for January 2026 in the amount of $8,510,710.50.
So moved.
Second.
Okay. All in favor?
Aye.
Aye.
Thank you.
Any moving along? Opposed? Oh, sorry. Just making sure. Opposed, abstentions, recusals? I didn't think so. Okay. Item number 6. Review and accept the report of expenditures for town and government for January 2026. Mary Jane, good evening.
Good evening. Any questions? I tried. Real quickly, on the revenue side, we are 91% received for the year already. We'll note that tax collection is doing very well at 93%, tracking even better than where we were last year. So all of our revenues are pretty much on track, unless there's any particular questions. All right. On the
We'll move on to expenditures.
On the expenditure side, we are 60% expended at 58.3% through the year. Most departments are right where we expect them to be. Obviously, the ones that are a little higher, most of them are due to timing. As I typically state, we pay a lot of our contracts at the beginning of the year. Couple items, the fire department had some significant issues in their buildings, so we have building maintenance is overdrawn for them. Public Works, Public Works is good at 57.8, but I just want you to be prepared for next month. So, we've had significant expense in Public Works for February due to not only the duration of the storms, but when they hit. It's a Sunday, it's a holiday, so when you see snowflakes, I see dollar signs hitting the roads. So February, you're going to see a big difference there.
Cold weather had an impact too?
Cold.
Or is it more the snow?
Both. We've been out a lot for ice. We have like today, it's a nice day today, so the water melts, and then tomorrow, we need to redo all of the sidewalks.
Right.
That type of thing. So it's both. But I would say the majority of it was the snow.
Right.
But certainly the ice plays a factor as well. So, Park and Rec, I'll note, we had discussion last month as well. We have a couple line items that are open. We have significant purchase orders, and the strategy there is that we have a number of blanket purchase orders open with different vendors for various needs that we may have. All of those will not come to fruition by the end of the year and would be canceled, whatever is not used. So that does skew their numbers for that. Other than that, I'll take any questions.
Hearing none. Anyone? Warrants. Any questions on warrants? Do we dare to go to the medical report?
Well, I'm not sure I need to talk about the medical report at all. I just want to note that as far as catastrophic claims, as Joe noted, in December we had 18 covered members over the 87.5. We are now up to 23 for January. The number covered over the 175 was 6. We're up to 8. So that just proves his point that the catastrophic claims are doing a lot of the driving on that. But I think we've talked enough about medical today.
Anything else for Mary Jane regarding financials, warrants, or medical report?
No.
Okay. I will entertain a motion to approve the reported expenditures for the town for January 2026 in the amount of $3,239,326.
So moved.
Second.
Sorry, did I hear a motion in a second?
Yes.
Yes.
Okay, thank you. All in favor?
Aye.
Aye. Opposed? Abstentions? Recusals? Okay, item number 7, consider and take possible action to set the interest rate for taxpayers deferring their taxes. Mary Jane, will probably be easier for you to discuss this, and we'll just put it in the form of a motion.
So each year, we bring forward recommendations for our 2 elderly tax relief programs. The first is the Guilford Supplementary Tax Relief Plan. We do base the interest rate on the 20-year spot yield for AAA-rated general obligation municipal bonds as reported by the municipal market data, and that is 4% at this point, so that is the recommendation.
So moved.
Second.
We have a motion and a second, Mike, for 4%.
Oh, well, that's fantastic. Okay, all in favor?
Aye.
Aye. Any opposed? Any abstentions? Excellent. Thank you. Item number 8, consider and take possible action to set the benefit cap for the elderly tax relief program.
So this had significant changes last year. You can see by the chart at the bottom that we did increase not only the number of applicants, but the benefits. I've had some discussions with our assessor, and it is her and my recommendation that that cap be increased to $1.3 million to adjust for any new ones that might come through this year. Bob, you might have more insight on that, I'm not sure.
Oddly enough, well, some of the new tax rules are having an effect on people's reportable income, so it could bring more people to the program.
That's why we increasing it some in the hope that we wouldn't have to come back.
Yeah.
So I don't know if you think that's enough or not.
It's, you know, they only began accepting claims now, and of course, they've got till May 15th.
May 15th, right.
So it's a little bit of a what do you know kind of a thing, but we can't, you know, at some point, you say no, or, you know, and then they've got to go back and redistribute pro rata, which is a nightmare.
Right, well, we changed the plan, so we felt we should bring the cap up to account for people that might now be allowed to.
Yeah, so I wouldn't have been surprised if you said $1.25 million, $1.3 million is not far away. It seems okay to me.
It's still lower than the cap was 10 years ago.
Correct.
Yeah.
Mm-hmm.
We were awfully close this past year.
Yeah, and it's okay. It's worth pointing out that when you look at the number of applicants over the years, you know, it used to be more, and the amount that was shouldered by the taxpayers to support this program has decreased percentage-wise over the years as well. So we're under 0.75%. When it was started, it was around 1.5%. So it's not that much of a burden.
Okay, any other questions? I'll call, entertain a motion to set the cap for the aggregate benefit of the Guilford Elderly Tax Relief Program for the fiscal year 25-26 of $1.3 million.
So moved.
Second.
Second.
Well, thank you. All in favor? Aye. Any opposed? Any abstentions? Thank you.
Thank you.
Thank you, Mary Jane.
Thank you, Mary Jane. Item number 9, receiving the proposed budget, Board of Education budget for fiscal year 2026-2027. It is my guess that in the room is Superintendent Paul Freeman and Chairwoman Kelly Balstracy, Dr. Freeman and Dr. Balstracy to present the budget.
We can grab that at once. No injuries tonight.
Brendan, I need permission to share. Thanks.
All right. Good evening, everybody. The Board of Education is coming to you with our proposed budget for the 2026-2027 academic year. I just want to very briefly walk through the last month, and then I'm going to hand it over to Dr. Freeman to dive into some of the details, and we'll jointly present the detailed information. On January 12th, the Board of Education met and Dr. Freeman presented a proposed budget to the Board of Education. This budget represented a 7.13% increase over last year, which we all recognize is high, driven by some pretty significant cost drivers, medical, salaries, electricity, some things really specific to running a school system and some things that we are all experiencing in our homes, only multiplied over 7 buildings in town. On January 27th and I'm sorry, I do want to mention one other really important part of that budget, besides the fact that it came to us following much work by Dr. Freeman, the district leadership team, the administration, to bring it down to 7.13%. That budget does include a reduction in 6 teaching positions in the district. That is possible due to some enrollment decreases, but it's a significant reduction nonetheless. It also includes a reduction in 2 kindergarten positions which were added after the budget was passed last year because we needed 2 additional teachers as enrollment grew over the summer. On January 27th and 29th, the Board of Education held 2 public forums on the budget and began discussing the administration's proposed budget. We met again on February 2nd to deliberate, and this past Monday, February 9th, we finished deliberations and voted to bring the budget that's coming to you tonight. This budget tonight represents another $654,542 in reductions to bring the proposed increase to 6.25%. We covered a lot of items in deliberations, and in our final decisions, we're driven by a number of things. I'll just mention a few. One is to really try to limit any impact on curricular or instructional related positions, because there were a number we were considering. The second was to limit positions in general, to try to see if we could find other places. We'll go into some detail in a few minutes, but there have been reductions that we made in tuition, special ed transportation, and regular ed transportation, district level textbook purchase, professional development, decreases in site improvements, and 1 custodial position. I'm going to turn it over to Dr. Freeman to go through some details. I have been on the Board of Ed for 14 years. This is by far the hardest position that I have experienced in terms of trying to figure out how to bring forth a responsible budget and maintain the important role we have as being stewards of this school system and maintaining the structure and the staff and the materials required to do that. Dr. Freeman.
Thank you, Dr. Balistraci, and thank you to the board for giving us this opportunity to share. Without spending time on these documents, without reading these documents to you, I'll just remind the board and the community watching that our budget is built on our foundation and on our mission of educating the students of Guilford. It is built on our portrait of a graduate. It is built every year on the annual priorities and initiatives that are set by the Board of Education. It is filtered through a series of budget assumptions, beginning with the fact that we will provide safe and healthy school environments. We mean both physically and emotionally safe and healthy school environments, in which we focus doggedly on continued instruction and learning. We look every year to build a budget that doesn't maintain the status quo, but that improves and extends the opportunities that we offer to the children of Guilford. And every year we work diligently to review every position, look at every dollar, and look at using existing resources creatively before asking for new resources. And this year is, again, an example of that. Every year, we budget only for the students that we anticipate to have in front of us in the coming year. We have a 10-year enrollment projection that exists on our website, but to briefly highlight that here, we again are looking at a decrease across the district this year. And specifically, we're anticipating a more significant decrease at the elementary grades, the K through 4 grades, than we are expecting. We're seeing a slight increase at the high school, but significant decreases in those K through 4s. We've looked very carefully at staffing and at class size and class sectioning this year as we've moved into this budget presentation. I also want to take a moment before beginning the presentation in detail tonight to point out once again the return on investment that the Guilford Public Schools provide. We look at two important measures every year. We look at overall performance as measured by the State of Connecticut Accountability Index, and we look at cost per pupil. When both of those measures are plotted on a percentage distribution, when you look at our performance, Guilford Public Schools perform at the 91st percentile, comfortably in the top 10% of all school districts in the state. When you look at investment, we invest at the 55th percentile. So while we spend per student at about the state average, we perform far, far above that investment. And I think that's important, particularly in difficult budget years such as this one. All of that being said, the budget that the Board of Education brings forward tonight is an annual request of $79,030,359. This is an increase over the current budget year of $4,646,769, or a 6.25% increase over the current year's budget. To put that into some historical context, it's important to note that over the last 14 or 15 school years, we have gone through distinct eras in budgeting. When I first joined the Guilford Public Schools, and it's interesting to note that this slide doesn't go all the way back to my first year, but when I first joined the Guilford Public Schools, we were looking at increases that fell roughly between 2.5% and 3.5% annually. We went through a really significant year of budget control, where for 6 years we looked at budget increases that were around 1% to 2% increases that we were looking at. Below 2% increases for 6 consecutive years. Guilford is not alone in that we have now entered into a different era of public school budgeting. School districts across the state and across the country are finding it more expensive to continue to offer the services to our students for a variety of reasons. But in the last 5 years, we have seen annual increases that outstrip either of those two past eras. We're seeing annual increases that are coming in at 3.5%, 4%, 5%, and this year 6% increases that we are discussing. I will note that the slide that shows investment versus performance accounts for those last 4 years. With those last 4 years of increases, we are still investing at about average for the entire state of Connecticut. Education is becoming more expensive. Education in Guilford is not becoming more expensive any more quickly than it is across the state. Every year, we try to take some time to talk about the efficiencies, what we have done in this budget that helps to control this budget increase. While I take pride in saying that the Guilford Public Schools has never stood still and that we have never brought forward a status quo budget, this year's budget has very limited new investments. There are only 2 completely new investments in this budget. They are both in place to support our special education students and programming, and I'll speak to those specifically in just a few minutes. As Dr. Balistraci already noted, within the guidance provided by Board of Education recommended class sizes, this budget already includes 8 reduced classroom sections over last year, 6 that reduced the budget and 2 that have been added to the budget this year, and we are not expecting to continue those moving forward. There will be 8 fewer classroom sections next year than there are today currently in Guilford Public Schools as part of this budget. That is not to say that we are exceeding class sizes. We are still providing positive and manageable classrooms with very skilled teachers, but it's just important to note that that's a significant change moving forward. Special education, we are seeing tuition investment for special education continuing to drop. Over the last 15 years, we have built out programming to keep more of our students in Guilford Public Schools, from 3-year-olds to students in their 22nd year. We are seeing students staying in Guilford Public Schools rather than being outplaced, and in fact, we're seeing students returning to Guilford Public Schools from outplacements in other communities and in private settings. We provide a better service, we do it at a better cost, and this year we're seeing tuition reducing relatively significantly. I'll point that out more specifically in just a moment. This budget has minimal equipment purchases that are included, and as always, I need to give our building principals and our teachers credit, but this budget also includes, as much as we can, really frugal investment in building level supplies and materials. To look a little more closely, we have for years been collecting the information, the spending that circles around those special education services that I mentioned. Tuition, when we do need to send a student out to a more specialized setting, transportation to those specialized settings, but also the contracted services that we bring into the district. As we keep students with more significant needs in district, we need to bring services into the district to support those students. This visual is always helpful because it points out that special education budgeting is some of the most volatile and difficult to predict. When students have emerging needs, we need to meet those needs, and it is difficult to plan in advance for many of that. I think the trend line is helpful because what the trend line does show is that while the variation continues, we've mitigated that variation. We've reduced the wavelength on that. We haven't eliminated the wavelength, but it's tighter. And you can see that our budgets are tracking more closely to our actual expenditures. You can see that in 3 of the last 7 years, maybe in 4, that actual expenditures has come in below budget. And you can see at the very end, the far right, that we're anticipating a reduction in those costs next year. So while tuition and transportation are going down, contracted services increase for the students that we keep in district, but as a net, it is still a reduction in spending. And as Dr. Balistraci mentioned, the story of every budget year is very often, and in the past 5 years specifically, it's the story of the cost drivers. More important than the intentional decisions that we're making about instruction in the school district, it's been those outside cost drivers that tell the story of the budget over these last 4 or 5 years. This year, there are 5 cost centers specifically. And once again, medical outstrips the salary increase. In a system that is so human-centric as public education, in a budget where nearly 80% of our budget is made up by the salaries and by the people that we employ, we should see the salary increase as the leading cost driver every school year. It's not this year. Once again, we need to add approximately $2.6 million to the medical line in order to meet the costs of those medical services that we are providing. And that is the single largest cost driver in this budget. The salary increase this year comes in at $1.6 million, $1 million less than that medical increase. That is after the reductions that we've mentioned. We've mentioned we've mentioned the 8 teaching reductions that were made. There's also been a clerical reduction that's been made as well. And in fact, I need to update that because there's been a custodial reduction that's gone into this as well. With those 10 FTE reductions, salaries go up $1.6 million. Our bus contract expires this year. We need to enter into a new bus contract for next year. We competitively bid our bus contract. We received approximately a 17% increase. That was the low bid. The next closest competitor was a 60% increase. That's an increase of $396,000. Electricity, we were under budgeted last year. We did not anticipate the costs increases that we experienced last year. We are anticipating continued cost increases this year. So we see electrical expenditure going up $369,000. And those contracted services that I mentioned, while this is part of good news, while we reduce that tuition cost by keeping more of our students in district and servicing their needs here in district, there is an increase for those local contracted services of $250,000. These 5 items alone represent an increase of nearly $5.3 million, or an increase of 6.68%. Remember, the entire budget increase that we're presenting this year is only $4.6 million. The work in this budget that Dr. Balistraci has recommended, the reductions that the Board of Ed took just this Monday evening, go to offset these increases. Everything else that we've put into this budget is here to offset the increases that are represented by these 5 drivers on their own. Joe already went over this, so I'll just touch on it briefly, but it is important to note, we had 6 really good years of medical experience in this school system. As we worked with our negotiations with our employee organizations, we changed to HSAs, we increased their share, we have increased in this last series the deductible for all of our employees, and for 5 out of 6 years, we actually saw medical costs decreasing. Just as we look at the overall budgets, we're not in that time period anymore. In the last 5 years, we have seen increases, and in fact significant increases, in 4 of the last 5 years. So we are responding to that changing medical history. I am not proud of the white space on this slide. At this point in the presentation every year, we talk to you about the important investments that we want to make in the Guilford Public Schools. I remind you that we perform in the top 9% of the state. I tell you that we are never status quo. We are always looking to do better next year than we are doing this year for our students. But in recognition of the magnitude of this year's budget increase, the investments this year are limited. This is the shortest investment slide that I've ever shared with the Board of Finance. This year, we want to add a half-time pre-K teacher, and that is simply a need that is being driven by enrollment at the pre-K level, the pre-kindergarten level. Additionally, this year, we are seeing a need to add an additional special education coordinator. This is an administrative position to support the special education programming, the special education staff, and the special education families at the elementary level. In the current model, we have 1 special education coordinator roughly for every 1,000 students. We have 1 who serves our high school population. We have 1 who serves our middle school population, working across our 2 middle schools. And we have 1 who serves our elementary population, serving all 4 elementary schools. One measure of the workload is how many PPT meetings those coordinators facilitate annually. At both the middle and high school level, across a 180-day school year, the coordinators at those levels facilitated approximately 300 PPT meetings, planning and placement team meetings, the meetings where we design the programs to support our students with special needs. Last year, our elementary coordinator facilitated over 500 PPT meetings. The fact is that in the current model, that administrator is spending most of their time in meetings rather than in programs and with the students that those meetings are intended to support. To just further that rationale a little bit, we have seen our special education population in district grow from 12% just a few years ago to 14%, and now by the end of this year, we anticipate a special education population of approximately 16% of our overall student population. To meet the needs of that growing student population, in the last 5 years, we have added 11.5 teaching positions. We've added 7 special education classroom teaching positions, 2 school psychologist positions, and 2 school social worker positions. We've added 13.5 paraprofessional positions across that same time frame, but we haven't provided the managerial or administrative support for all of those additional adult positions. It's worth noting here that the tuition line that we mentioned as an efficiency, the tuition line is decreasing by $648,000. The investments that I mentioned total less than $200,000. So these two positions to support those special education students that we are keeping in district are more than offset by the reduction in tuition that has been required, that would be required to send those same students out of district to receive those supports. I also just want to note that both of these new investments represent less than 0.25% of the increase that we're discussing when we talk about the increase in this budget. So I understand that in difficult budget seasons, it is difficult to add anything new, but we believe that these are essential and they represent a very small portion of that overall increase that we're discussing. I don't do this every year, but I do want to spend some time this year talking about other investments that we would have liked to have seen on that previous slide that are not there this year. There were lengthy and significant conversations that we had with the public back in October when we hosted 2 public meetings and asked parents and community members to come in and tell us what they would like to see in this year's budget. We met with our leadership team and asked the principals and other district leaders what needs to be in this year's budget. And we looked at items that were cut out of budgets over these last 4 years. This budget does not include an extension of math intervention positions. We added 2 last year. We really wanted to add 4. We thought that we could scale this, add 2 last year and 2 this year. We're not bringing that request forward. A school district of our size really should have a data office. I apologize for the typo there. There should be a data office where we have somebody who works with data analytics who helps us understand how our students are performing and how we're managing those. And that's a request we're not making this year. We had parents request increased speech and language services. We wanted to grow our curriculum office, not with new FTEs, not with full-time positions, but by offering teachers stipends to work outside their contract day with Dr. Goss to renew and refresh curriculum. We have had parent requests to conduct another transportation study in the hopes of looking at school start times. We wanted to extend our paraprofessional workday. Right now, our students are in school for a longer workday than our paraprofessionals who support them. We need to stagger para days in order to provide the coverage. We were looking to extend the paraprofessional workday to match the student day. We did not add approximately $200,000 to this year's budget request to meet that need. Likewise, we were looking to extend the support of clerical positions at the elementary schools. There were significant equipment purchase requests that were not honored. We wanted to increase the site improvement line, that small item annual preventative maintenance line that we want to grow to 1% of our overall budget. This slide represents an increase this year that we didn't add. We started this budget by flatlining site improvements. On the next slide, you're going to see that we've actually reduced site improvements, and for the first time in many years are moving backwards rather than forwards with that important line. We did not add money to professional development, and we did not add for a textbook increase. And again, in an upcoming slide, you're going to see how many of these lines have been cut back further with reductions. Dr. Balistraci and I have both already mentioned that this budget comes forward with 8 fewer teaching positions, 1 fewer clerical position, and you'll learn in the next slide 1 fewer custodial positions as well, as a starting point. And then this Monday evening, the Board of Education looked at the budget that my team and I provided to them as a starting point and made further reductions that I think Dr. Balistraci sort of foreshadowed, but...
Yeah, no, just so briefly, 1 custodial position, 17,000 from the district-wide professional development line. There is a decrease here in tuition. I know we all together watched that line very closely. We're feeling somewhat comfortable in this decrease as we are getting a sense that the excess cost reimbursement that we might expect next year, which we were budgeting at about 59%, might be a little higher at 63%. We did, as Dr. Freeman noted, oh, sorry, I'm jumping. Textbooks, $237,500 from the district-wide textbook line. This will be a deferral of the purchase of social studies books across grade levels as a new social studies curriculum is being planned for implementation. The site improvement line, which came to us in Dr. Freeman's budget as flat funded, we took $50,000 out of that, and then a decrease in the transportation line, partially a product of that excess cost grant, which can go to special ed transportation, and partially because we have transportation we also provide students to other school programs, and we have tried to address the possibility of using vans instead of buses based on number of kids. So again, a decrease of $654,542, almost 1%, from a budget that Dr. Freeman and his staff had already reduced by a number of positions, as well as many other lines that we haven't gone over here.
To look at that staffing all together in one place, I like to try to show what those staffing changes will look like. So you note the increase in the one administrative position for special education coordinator at the elementary level. I will note that that is only a 10-month administrative position. It's not a 12-month position. You note the part-time pre-K teacher. And then last year, we had reduced our paraprofessional staffing by 5 paraprofessional positions. We anticipated being able to stay at that level. This year, the needs of the students have required us to add those positions back into the budget. And so while we're staffing those now, we will be adding those positions into next year's budget moving forward. You then see the offsetting teaching positions that we've talked about, the offsetting clerical position that I have mentioned, and the district-wide custodial position. So it is a net decrease in staffing next year, and most specifically, a net decrease in those classroom positions that we have mentioned. Again, the story of this budget is not the new initiatives that we're bringing forward or the innovations that we are asking support for. We will continue to provide the quality education that we have always provided. We will provide, to some degree, a small degree, more structure and support for the special education students and programming that are part of that overall quality that we present. But the story of this year's budget, once again, is that significant medical increase. The well-earned and well-deserved salary increases that we have negotiated with our bargaining units, the fact that transportation is going up significantly across the state and here in Guilford, the electricity increase that we are collecting, and then as Dr. Balistraci just noted, various non-discretionary inflationary cost increases that are hitting lines all across this budget. And simply everything that we're bringing into the schools is a little more expensive this year. Alongside this operational budget, on Monday evening, the board approved a bonding request, and again, it is very small. We're asking for 2 projects to be funded this year. One is a partial and very needed roof replacement at Adams Middle School. There are sections of the roof that are 40 years old that need to replace. It is specifically centered around the gymnasium area. If you have children who participate in park and rec athletics or school athletics at Adams after hours and on the weekends, every time it rains, you see the garbage pails that are out on the hardwood. So whatever the future of Adams is, that roof replacement is going to be required. And then, as part of a district-wide facility study that we conducted with Fryer and Associates Architects, they noted for us, we asked for this, but they also helped us map out some safety concerns around the buildings, particularly in outdoor areas around our buildings. And so while we plan on scaling this, a partial response to those safety items that have been noted, and these would be essentially bollard or guardrail controls around areas where students are outside and vehicles may be moving or have access. There is a $100,000 request for that safety infrastructure. As we do each year when we bring forward a bonding request, we include a line item for architectural and engineering costs for future projects. and it makes a total bonding request this year of $1,830,609. The annual operational request and the bonding request that we bring forward, again, is to continue offering the quality programming that we provide to the children of Guilford. We continue to be enormously proud of that product. We recognize that we have wonderful students in this community. We recognize that we are supported by engaged and thoughtful parents and by a community that has continued to invest in this program. We're proud of that investment, and we're proud of the return on that investment that we bring forward every year in partnership with the students and their parents. And Dr. Balistraci, I'll turn it over to you to close.
No, really just to end on a high note, right? So we're sitting here feeling the pressure of both the expenses and the things that we've had to reduce. But the good news is that this is Guilford Public Schools. Guilford Public Schools has a stellar reputation in the state. We have students who are experiencing a high level of academic excellence, are leaving Guilford Public Schools, going to colleges, going to jobs, going to the military, really finding success post Guilford. We have a community that, as Dr. Freeman noted, supports us in innumerable ways. Guilford Mentoring, all the booster clubs, I got to mention this on Monday night as we accepted another couple of donations from booster clubs. Parent volunteers, I mean, just a tremendous support from this community. And so we celebrate Guilford Public Schools, and we bring forth a budget that we have tried to very carefully look at, because we are well aware and so appreciative of the community that supports us, but really represents the needs that we have in order to continue the excellence that we provide. Thank you.
Dr. Balistraci, Dr. Freeman, thank you very much. I do see on the slide, it says discussion. I know that we're going to have plenty of time for discussion at our March meetings. I do want to make sure the town has an opportunity, of course, to do a presentation. I am going to ask, because I know we're over, I think we're about the 2-hour mark, ask our videographer, Michael, how we're doing in terms of 8.
He's saying not a problem.
You're good.
Not a problem. Okay, so I just want to make sure we're not stopping in the middle of our first selectman's presentation, because it usually happens. So just trying to avoid that now. Again, Dr. Balistraci and Dr. Freeman, thank you very much. We look forward to having ample discussion with you at our public hearings.
Wonderful.
Thank you all.
Thank you.
Thank you very much.
Thanks very much.
Moving on to item number 10, receive the proposed town budget for fiscal year 2026 and 27. First Selectman Manoy.
I think there's a motion for health break here? Yeah.
Oh, I would love that.
I won't stand in the way. Well said.
Over here. Recording stopped.
Okay, I'll be back.
Ready? Mr. Chairman, are we ready?
Yes, all set.
Great, thank you. Many years ago, I heard a speaker at a conference who said, he was the last speaker, and he said, I'm going to make this short because I don't want to be between you and happy hour. I don't want to be between you and your pillow at this hour. I don't think happy hour is going to happen. We might have missed that. Good evening, and thank you for giving us the opportunity to present the budget that was recommended by the Board of Selectmen. And I'm getting a little jealous. You guys have more unanimous votes than we seem to be having these days. I want to thank my fellow board members and the department heads for their great work in putting this budget together. And I also want to thank the Board of Finance for their participation in the budget workshops. I think that's an essential component to you understanding what I'm going to be presenting and talking about tonight. I think you've heard me talk about the fact that a budget is a reflection of our values as a community, and I think the superintendent would back me up on that statement. So what is the ultimate mission for town government? Well, society first gathered together for public safety, public protection and public safety. We also strive to maintain infrastructure and sustainability of our resources as well as our facilities. Provide exceptional town services, high-quality town services. Support our Board of Education because of the impact that it has on the quality of life in our community, all the while trying to meet community expectations. So my staff doesn't know that I'm doing this because I'm diverting from the original presentation, but earlier today we received preliminary information from Zen City, which is one of the social media groups that we use to do surveys within the community, et cetera. And we had a survey-wide community on satisfaction and emphasis on where we should be focusing our efforts. And again, this is a statistically valid survey. I think there are over 500 respondents. It's all done via some science that I don't understand. But in rating of the overall quality of life in Guilford, the number is 81% say it is positive, all right? 15% neutral and only 5% negative. When we start talking about some of the more specifics, sense of overall safety, 86% positive, 10% neutral, and what was at least 4% negative. Overall cleanliness and maintenance, 85%, with a 12% neutral rating. Quality of parks and recreation amenities, 81%, with a 14% neutral. Access to quality education, 79%, with a 13% neutral. Availability of a variety of art and cultural events, 74%, with 18% neutral. Sense of community among residents, 68%, 19% neutral. Availability of senior and social services, 66% positive, 23% neutral. I suspect those are the teenagers and 40-year-olds, right? Overall quality of services provided by the town of Guilford, 57% positive, 22% neutral. That suggests we might have still some work to do. Ease of getting around by public transportation, 27% positive, 33% neutral. I'm not sure what we can actually do to accommodate more public transportation, although we are trying. Extra Mile, if anybody has had the opportunity to use that service, I'm getting word that that grant, which was due to expire this June, is going to be extended for at least one more year. And then the last one, availability of affordable housing, 15% positive, 30% neutral, 54% negative. So I think those kind of things tell us where we ought to be focusing and what we ought to be trying to do to meet the expectations of our community. So, sorry to my staff for taking a left turn. Next slide, Karen. Thank you. Obviously, some of this is going to look familiar to those of you who have been here. We want to continue to maintain the high level of services that our community is expecting and perhaps demanding. We want to assure appropriate staffing levels to meet the community expectations while optimizing employee performance. To that, this budget includes some new full-time positions. I know most of you sat through the presentations and you saw a significant number of requests for additional personnel. What we are proposing this evening for your consideration are new positions there are three full, I believe, full. Planning and zoning and health department permit tech. I think we've demonstrated that the demand and the workloads in those areas are requiring more resources to better serve the community. I will admit that some of the more frequent calls to my office are about the process and the time it takes to get through the land use departments. Town Properties Custodian, we've been short for quite some time. And now we have picked up the Lathrop House as another facility. So we are looking for another custodian to help us with the load of maintaining and cleaning the facilities we have here in town, because we don't contract that out to cleaning services. Also, there's a new mechanic in Public Works. These numbers were staggering when they were presented to us at the workshop. In the mid-'90s, we had about 75 plated vehicles that were utilized by the various departments in town. We're now up to over 130. And some of those they're not all cars or trucks or whatever. Some of them are, the big mobile machines, et cetera. But we had 5 mechanics in the mid-'90s. We have 5 today. And the sophistication that's required to maintain so many of the new vehicles today is significantly higher. But just the volume, obviously, speaks volumes. We've also focused, again, this is a consistent theme for us, funding pensions and the OPEB liabilities at actuarially recommended levels. I think we've demonstrated a commitment to discipline in this regard. And continued investment, expand tax relief programs for the veterans, elderly, and disabled. The expansion comes in here because we adopted a new provision that was made available to communities to extend to veterans who have 100% disability the exemption for their land, not only their housing. This was a choice that was given to every community in the state, and the Board of Selectmen unanimously decided to adopt that provision to expand that those tax exemptions. We've also continued to invest in information technology, and you'll see a big number a little later about how information technology is moving forward. Next slide. Thank you, Karen. You're already ahead of me. These are scary numbers. The 7.99% operating budget is a big, big number. We have not, I think we're consistent with the superintendent, we haven't seen numbers like this in a long time. And we have the same pressures that the Board of Education does in many areas. The operating capital budget is, I want to call it flat. It's basically flat, which is somewhat of a disappointment, because we have been looking to increase that pay-as-you-go mentality with our operating capital budget, but this year we just couldn't do it. I would love to index that amount to inflation just to stay current. Perhaps next year we'll have an opportunity to get to that. Unfortunately, debt service is flat, but it comes with a caveat. We're using more premiums than we have typically used in order to keep that flat. So what we're presenting tonight is a 6.15% overall town budget increase. Let's talk a little bit about where the pressures are coming in that regard. I think you may recall that there were pretty significant cuts made to the budget by the Board of Finance last year. We have restored many of those cuts that we had to impose as a result of that significant cut we went through last year. I'll give you a perfect example. Overtime in the Public Works Department. Probably not the place we should have gone, but we went there because we had some history that said we might be able to take the money out of that. Guess what? We're in trouble. MJ just told you that a little while earlier. Our medical is a significant increase. And let's not forget, we had the utilization of fund balance that made the increase last year look lower than it really was. So now we don't have that same funding mechanism. So that's $165,000 on our side, and I think the total was $750. So that's one thing we have to remember, is we tried to soften the blow on the anticipation that we were seeing a blip in medical costs, because as you saw in the document that Dr. Freeman put up, we had many years of bounce back years. We got caught. Utilities. Same issue that you saw on the Board of Ed side. Those costs are up 8.2%. all right? Fire hydrants, 9.1%. Purchase services have increased by about 6%, and that's things as simple as public notices, tech support, GIS, uniforms, equipment and building maintenance contracts, and copiers and printing. So, but I want to talk about one thing, and I think you're all familiar with this. This budget also includes it's a strategic effort to rein in the cost and continue to provide the level of service, the quality service, and response times at the fire department. Chief Shove, who I think is on here, is to be credited with coming forward with a proposal after doing a significant amount of data analysis on EMS calls when they occur, when the predominance of them occur, which is ironically between the hours of around 9 a.m. and 5 p.m. There's been a significant increase in calls where we're going to CVS after somebody goes to the Minute Clinic, somebody goes to their physician locally. So we're doing an awful lot of calls. And what's happening is we're calling out the second and third ambulance more often. All right. And when we call the second and third ambulances out, we wind up with overtime and replacement salaries. So this proposal includes $200,000 in expenses related to hiring part-time EMS-only technicians to man the ambulances during those peak periods. The offset is $300,000 worth of anticipated revenue. I'm going to tell you, in my house, if I could spend 2 to get 3, I would do it. So I think, but that means that 7.99% increase is partially responsible, is partially attributed to that kind of increase. A couple of other things I just want to highlight. Overall salaries increased 6.5%, and that's inclusive of the new positions that we've added. And without those new positions, the salary line item would be about 4.83%. Next page, please. Thank you. Here's a summary of our reductions. In essence, we cut $875,000 out of the departmental operating budgets, over $450,000 in capital. And let's remember, when we say we're reducing that capital budget, it's not the truth. We're deferring it. It will be part of the 5-year capital plan going forward. So a total of over $1.3 million cut out of the budget. And those cuts included areas in employee benefits. The police department was looking for 2 new positions, which we did not include in this. Public Works was also looking for another maintainer, which we cut. Park and Rec was looking for a maintainer slash foreman, which we did not put forward. And Natural Resources, we took a whack at their tree budget owing to the fact that we have some greater sense of cooperation between Public Works and Natural Resources because we now own a bucket truck. So again, capital is again not where we would like it to be, but this year we have to keep it down at that level. And then I mentioned earlier that debt service numbers are reflective of using additional premiums. Next slide, please. All right. In the fire department, which represents 43% of the total requested increase, a bulk of that is the EMS staffing, which I mentioned is more than offset by additional revenues. In IT, the transition to Microsoft 365 from a premise-based service delivery platform is responsible for a significant amount of those costs. On town properties, I mentioned earlier, fire hydrants increased by 9.1%, utilities 8.2%, but that includes obviously a new full-time position. So. Under employee benefits, that represents 40% of our requested interest. So if you combine both fire and employee benefits, that's 83% of our total request for new money. And then, of course, planning and zoning and health is that permit technician that I indicated would be split between the two departments. All right. Next slide. Thank you, Karen. So you can see, this is pretty evident. The retirement plan contributions are up 7.16%. Some of that is related to a more aggressive 401k match program that we agreed to in negotiations this year. The OPEB benefits are consistent with the laddering schedule that we laid out a couple of years ago. Remember, we're trying to get past the pay-as-you-go for employee post benefits. And then actually, there's an increase in the FICA because of the increase in salaries as well as the new positions. Next slide, please. Capital budgets, vehicles constitute 240,000 or so. Those are police patrol cars and the outfitting of those, the uplift on those, and one new fire administration vehicle, which will replace one that needs to be retired. Equipment, public, not park and rec, but our golf course, a new mower, and park and rec with various equipment, mowers and attachments, and also our fire department with firefighting gear and essentials. The infrastructure increases are engineering on sidewalks, ADA compliance, and draining projects. Building maintenance, the community center parking lot ceiling, and police surveillance videos, a video system and updates. Technology, small number, 10,000, but that is the annual tech replacement program at the library. And then lastly, field lake improvements, weed control at Lake Quanapug, irrigation at Adams Field, the well water at Nut Plains Park, and there are also some needs to replace some of the piping at the splash pad down at the beach. Next, thank you. The trend, let's go to the next one. We already know this. We flatlined the capital. Components of the bonded debt service. As I said, that is flat because we have utilized premiums to keep it flat. And the respective portions between the Board of Education, the town, and the new high school are pretty evident. But the good news is when you take a $10 million out of a $40 million budget and you keep it flat, that covers over some other increases. Next page, please. I usually refer to this as Mary Jane's favorite slide because this was one we put in place. I think Chairman Ailes was responsible for this, helping put this together when we talked about the debt service schedule related to the new high school. And as you can see, we're just about there. The utilization of the premiums has given us the opportunity to take it down a little bit. It would have been consistent with the next 2 years. But Bob, you'll be happy to know that over the past couple of days, Bill Lindsay has talked to us that there may be a refunding opportunity.
It's a falling, let's go.
There we go. And it's also timing on what's allowed to be refunded, as you know, but
free money.
That's it. So there is an opportunity for us to do a refunding, which could significantly impact the next couple of years out, but there may be an opportunity even in this fiscal year. Hopefully, whether we'll know that by the time you have to make a decision is unknown at this point. All right, there's some good news. Operating revenues, local operating revenues are positively enhanced, and you'll see a moment later why with the grand list growth. But interest income, we're anticipating a $300,000 increase. Building permits, which includes not just building, but includes all the permits over there, which is one of the reasons we're asking for that permit tech, because the demand and the revenue is there. Town clerk's office minor, EMS revenue, that's the fire department. And then delinquent taxes, an increase, moderate, other local, and MJ can explain those if you're interested in getting into that level of detail. But the good news is we're seeing almost $1 million in new revenue this year, which you'll be happy to know will offset the 6.25 and the 6.15 increases you've just heard us ask for respectively, which will help drop the mill rate increase down significantly. We're coming in on the state side. Relatively, we have an increase year-over-year budgeting because last year we had not anticipated a grant that was given to us after our budget was passed. It was a stabilization grant that the legislature put in place to protect us from having feeling the continued impact on our ECS funding, which was scheduled to drop. All right. Next slide, please. Net grand list. I think this slide last year looked a lot different. As you recall, we had a negative growth last year, largely a result of the change to the motor vehicle tax methodology, shifting off of the Blue Book value to a depreciation schedule, and we've rebounded nicely from that. So this is also going to also contributes to additional local revenues based on previous year's tax rates. All right, your pillows are calling. Mr. Chairman, thank you very much for allowing me to make the presentation. I stand ready to answer any questions if anyone wants to at this point. But we'll certainly be prepared at our March meeting.
First off, Mahoney, I know we're at a point that is fairly late. I know that I passed on discussion with the Board of Education. I think for the most part, I'll do the same tonight. For the town, we will have plenty of opportunity to do that as we approach our March 3rd and March 5th dates, and I'm sure I would add also regarding the town and Board of Ed budgets, I could cover this in new business, but I'll cover it now, that if there are questions from the Board of Finance specifically, they should be submitted directly to, I believe it's Mary Jane on the town side, and if I'm not mistaken, it would be maybe, is it Linda Trudeau that should be getting the message, any questions for the Board of Ed, or Katie?
To Katie Balistraci.
Dr. Balistraci for the Board of Ed. Okay, so I know every year there are questions that get generated from the Board of Finance. So any questions prior to March 3rd, I wouldn't do it March 2nd, but certainly give it a 4 or 5 days prior, maybe even a week, maybe a week. We'll say a week before March 3rd, submit any questions regarding the budgets.
Mr. Chairman?
Fair enough.
Good. I don't know how many members of the public are on still at this point. God bless them if they've lasted this long. But they are free to reach out as well to our finance office with any questions about our budget, which will be published in a newspaper of local circulation within 2 weeks? Soon.
Great. And I will cover that a little bit in new business as well. So thank you for adding that.
Thank you.
Okay. Thank you again for the presentation.
Thank you.
We can move on to item number 11, which is committee reports. I don't believe there are any standing committees right now, so we'll move on to item number 12, which is old business. Did anybody have anything under old business?
No.
Hearing none. Item number 13, new business. Anything under new business? Actually, I do have a few items which are my kind of annual new business items this time of year. I wanted to just cover the next steps into the budget process. First of all, we will be having our meetings on March 3rd and March 5th, and possibly March 10th. I'm sorry, March 9th, that's Monday. In the same room that we're in now. For live streaming purposes, the Board of Finance public budget hearing will be on Tuesday, March 3rd at 7:30 p.m. We are going to hold public forum before and after the presentations by the Board of Education and the town. It's been our recent practice to allow the public to ask questions of the Board of Education in town after the presentations. as well as limited questions and comments by the Board of Finance that evening. Regarding the Board of Finance budget workshop, they are both scheduled. They're scheduled for Thursday, March 5th and Monday, March 9th if needed. I mentioned both dates because it's possible that both nights could be utilized to discuss and decide on the budget to move forward to voters due to weather or extended deliberations. Going to what our first selectman just alluded to, the Board of Finance does encourage public comments about the budgets to also be submitted in writing to be read and or summarized into record during the public forum. And the town will provide a link on the town website if it's not already there with an email address to send comments to or email any of the board or actually you can email any Board of Finance member directly. Is there any other comments or new business to come before the board or anything that I might have missed?
No.
Nope.
No.
Excellent. Okay, hearing no further new business.
Is this the final, is this the public
Yeah.
comment time? Sorry.
You are almost there. Actually, item number 14, public comment. Catherine.
Thank you, thank
You're
you.
up.
I held all this long, so.
Thank
I
you
had
for
to
staying
jump
on.
on.
For everybody who stayed on, thank you. Appreciate it.
Yes, so thank you so much. I just wanted to, I didn't know that the Board of Ed was going to further reduce the proposed budget, but.
Could you
I
just give us
fully
your name and
wanted to
address,
let the
please?
Finance know that I fully support it.
Catherine, sorry. Can you, just for record, name and address? Sorry.
Yes, sorry, Catherine.
Should have said that
Shire.
before.
That's all right, sorry, my first meeting. 60 Wilbur's Lane, Guilford. I have a child in kindergarten, and I just wanted the Board of Finance to know that I do thoroughly support the Board of Education's proposed budget. I support the budget at the 7% increase. I'm really sorry to hear that they're not going to be able to add the 2 teacher math intervention elementary positions and the speech language pathologist, but I do really appreciate the work that the Board of Education did to further reduce that budget increase. Thank you.
Thank you, Catherine. Appreciate your comments. Anybody else wishing to address the Board of Finance in public comment? Okay. Last call. Anyone? Okay. Thank you very much, everyone. Item number 15 is a motion to adjourn.
Move we adjourn.
Second.
Thank you. All in favor? Aye.
They adjourned
Thank you, everyone.
The recording stopped.